My name is Aaron Kacharski. I'm a grassroots coordinator and trainer here with Recovery Advocacy Project. And today we are covering legislative-based solutions. And we also have two amazing guests with us today. We have Representative Lauren Davis from the state of Washington. And we have Shelly Weizman, who is from the O'Neill Institute from Georgetown Law. And so these folks know policy, they know it as advocates, and they know it as educators. And so we're happy they're joining us today. I just have a little bit of a PowerPoint, and then we're going to turn things over to our special guests, and we're going to follow it by Q&A. And so there'll be time to ask questions. You can feel free to use the chat box for now, and then we will open it up and stick around for a little bit after the guests have spoken. And so, great. Give me 1 second. I'm going to share my screen here. Do not panic, organize. It's gonna be our new t-shirts. All right. The first thing I wanted to take a minute to talk about, I know we've referenced it a couple times. I know that we talked about it a little bit on orientation. This is something that's gonna be updated in the next couple of weeks and into the month. And so there'll be more categories in 2022. There'll be stuff specifically on mental health. There'll be overdose prevention sites or supervised consumption site legislation. What you're looking at right now is the Recovery Advocacy Project model legislation page. And, we're all on state teams, and a lot of the times there are community-based activities that people can get involved in based on what's happening on the grassroots level. There's also legislative solutions that can help generations of people that you might not ever meet. And to me, that's kind of one of the more exciting things when you think about policy change and passing laws. If you pass a law that creates recovery high schools in your state, there's generations of young people that can benefit from that. And so I think about policy in that terms of recovery advocacy as, we do things for ourselves in terms of our own personal recovery, but we can do policy changes and recovery advocacy to help people that we might not ever have the pleasure of meeting. And so I wanted to just take a minute to scroll down some of the in terms of the model legislation page. And so these are all local issues. And so we found state laws that have passed in different states for all these different categories, whether it's Narcan in high schools or peer recovery support services or access to medication-assisted recovery. And you can come here. This is recoveryvoices.com/legislation. You can find it in the menu. And you can come here, and I would encourage everybody, even if you don't think that like public policy or laws is like your thing, that's okay. I used to not really enjoy this sort of work, and then I just really got into it once I started doing advocacy work. And I worked in New Jersey for between 2010 and 2018, and we built an advocacy program out there. And we were able just to pass law after law after law with the support of the grassroots community, our elected officials, and the governor. And the best thing about it when I think about stuff like that is a lot of those laws that we passed, we took those good ideas from other states. We said, this is what happened in Massachusetts, or this is what happened in Oregon, and we want to do it here. And we're able to introduce it in New Jersey and so forth. When we passed something in our state, there were other states that wanted to pass those laws too. And so I encourage you to come here and really just take some time and go through, if you want to learn more about syringe service programs or declaring addiction as a public health emergency. There's racial equity and justice bills and local efforts. And it's not just legislation. There's a lot of examples here on like town councils or local initiatives or things that governors can do, passing resolutions. That's all here. And so if you see something that's missing here, I encourage you to just reach out to myself or Garrett. We're making changes to it right now. We're adding a number of different categories. And so I just wanted to put that out there before we really get rolling on the PowerPoint today. And so know where that is, recoveryvoices.com/legislation. All right. All right. And so just tonight, we already kind of covered the model legislation page. You know, going from state organizing team to state organizing team, it's just reminding me that there's just not one like magic way to go about passing laws in a state. But a lot of it is about building relationships and figuring out, it's almost like you're building a puzzle with your state organizing team. You know, here's the policy, here's the idea, who is connected to that idea, and how can we get there as a team? You know, what are the steps that we have to make progress with the bill that we're working on? And so we're going to talk about different steps to introduce legislation. We're going to hear from Representative Lauren Davis, and then Shelly Weizman from the O'Neill Institute is going to talk about just diving a little bit deeper in terms of how you might want to get involved. There are opportunities for Recovery Advocacy Project team members to, if this is your thing, you're like, yeah, I want to dive deeper, I want to learn about addiction public policy. There are programs out there that you can apply for that are specifically for this. The fact that there is programs for addiction recovery policy now is amazing. And so it's almost like you can go through, take classes, learn more about things. And so we're going to have Shelly Weizman join us and speak a little bit later on. And then, and so moving on, here we go. And so I just wanted to keep this up here. If this is your first time to a Recovery Advocacy Project training, just take a look at that last line there, just really talking about where Recovery Advocacy Project is working to build a visible and effective constituency in demand of community, and this piece here that we're talking tonight, public policy-based solutions in response to America's longstanding addiction crisis. So that's really what we wanted to focus on tonight, is that piece of the public policy solutions. And so this is all in your organizing manuals, if you need to go back and find that language. And so you all have a state organizing team. I was on the Wisconsin team last night. They're doing an amazing job just in terms of organizing themselves. They all know who their elected officials are. They have done listening sessions. A lot of you are on teams that have done recovery community listening sessions. So you've listened to people in recovery, and you have drafted and created your state platforms. And those platforms really, it's like a public facing way to let people know what the priorities are in your state based on those listening sessions. So people in recovery from all pathways and family members told you what was important to them, and you all created these platforms. And so once you are able to do that, it gets a little bit easier in terms of identifying a potential issue that you all feel like can be addressed legislatively through legislation. And so one of the things that we would ask people to do is check if there's you can do this research, anybody can do this research, and you can do this as a team and figure out the answers to some of these questions here, figuring out whether there's a bill that's already been introduced in past sessions. If there is, and it didn't pass, if it didn't become law, diving deeper and figuring out why, figure out where it got stuck. Maybe it didn't have the grassroots push behind the issue. Maybe the policy isn't good. It might not be what people are ready for right now. Are there like baby steps you might have to do in terms of getting something passed? And so, one of the things that is important that when I've worked with advocacy groups, you want to be familiar with the political landscape, know what party's in power. And the reason why I say that, I just want to share that I've been involved with, I've lived in states where with Republican governors and Democratic governors and Republican controlled legislators and Democratic legislators. And we've been able to pass legislation in all of them. And so the reason why I bring that up is because if there are, for example, if the Democrats have more seats in your state legislature, or the Republicans have more seats in your state legislature, that means that they are also in charge of the committees where the bills go. When you introduce bills, it goes to a committee. And so knowing that is important in terms of like the makeup of the committees, knowing who the chair people are is very important. If you don't know who your own, know the political party of your governor, all that stuff, this is all stuff that you all should research and make sure you're on the same page with as a team, and understanding and seeing if they have a connection to the issue. That time that I was in New Jersey, it was a governor that, I didn't see eye to eye with on 80% of the issues, but on addiction issues, we were right there on the same page. And so being able to work with members of both parties, your state organizing teams have members of both parties in them. That is a good thing. And so, or all parties or no parties, that's fine too. And so if you don't know who your own personal elected officials are, there's a great source at openstates.org. You can just type in your address. It'll tell you who your state senators are and who your state representatives are. And then just kind of have a discussion with your team. Massachusetts did a really good job with this. They noticed that more than 80% or more of the addiction legislation in the state, the addiction recovery legislation in the state, passed through the health committee. And so they met with the chief of staff to the committee chair of that committee, and talked about the different bills and talked about their platform. We're doing that in South Carolina as well. And so the last thing that we encourage you to kind of think about and to look into is look at who some of the champions are on the issues that you care about. Look at some of the bills that they've sponsored in the past. Look at some of the bills that have passed in your state, and then check out who the names are and in terms of the sponsors and the co-sponsors. And those might be ideal people to reach out to ask to sponsor your bill that you're looking to get introduced. And so I mentioned there's a lot of different ways. We still have some folks in still letting some people in from the waiting room here. Sorry, I just noticed. All right, we're back. All right, I had mentioned that there are a lot of avenues. I don't think that there's like a one size fits all, like this is how you have to do it, because the makeup in your state from state to state is very different. I think the first step is not even just knowing who your legislators are, but actually having conversations with them and building relationships with them and their staff. Elected officials rely on their staff for a lot. I think a lot of elected officials, that it's like they might not be specialists in a lot of different areas. They're kind of like generalists. They generally know a little bit about this, and this. And so they really rely a lot on their staffs. And so it's okay if you call your elected official and you start a conversation with a staff member. That's okay. And so by doing that, you're kind of steps ahead in kind of building that relationship. And one of the things, honestly, like I had sent a letter to my elected official when I moved to Myrtle Beach, and I got a form letter back. and my response back to that was like, no, I don't do form letters. Like I would like to have I want to have a real conversation with a real person. And that opened the door between advocate and my elected official. And so I just wanted to share that sometimes, you might have to nudge a little bit, and that's okay. They represent you. Okay. And so it's important to insist on a conversation or a sit down or a Zoom meeting for 20 minutes, whatever it might be. And maybe it's a little easier to talk to legislative officials this time now that it might not, there's less in-person events. So maybe it's easier to catch somebody on a Zoom or whatnot. Every state has an Office of Legislative Services. It might not be called Office of Legislative Services in every state, but it's a version of that. And they are in charge of drafting language and working with elected officials and their staff, and they can work with constituents. And so those are folks that kind of know the language piece. It's like you don't have to feel like, oh, I have this great idea, I have to go write the whole law. That's what it is. There are people that are assigned to help you to do this sort of stuff as constituents and legislators. And then the other piece here, there are local organizations that might have those relationships already built, and they have those expertise. If I was working on a bill around mental health or harm reduction, I know the local organizations that specialize in that. And so I can go to them and ask them if they have relationships with a couple legislative champions and go that route. And then the last one here, we're doing this in South Carolina, where our single state authority, our Department of Substance Use Services or Addiction Services or Mental Health Services, however you call it in your state, they actually have recovery coordinators. And so we're introducing a bill that introduces preferred language for persons using persons with substance use disorder or persons with in recovery. And so we wanted to reach out to the recovery coordinators of the state to see if they would get behind it. And they loved it. And we're working with them and reaching out to different allies in doing that. And that makes things a little bit easier when you say, hey, we got this great idea, let's go organize that support and make things a little bit easier on all of us. All right. And so there's no one size fits all here. And so here are just kind of some next steps. Once you get that bill assignment, when your idea officially has like a bill number, it becomes very real. Somebody sponsors there's a prime sponsor on your legislation. You have to work to go and get co-sponsors. You can ask the sponsor about co-sponsors they've worked with in the past. You can consider making it bipartisan. And then you can also go, I know a lot of people here are familiar with Action Network that we use. That's our digital organizing tool. And so we can create letter writing campaigns around those pieces of legislation. We can generate the grassroots supports with petitions of support as well. And then one thing that the Texas team did an amazing job at was every single member of that team last session signed up to get legislative tracking. Every state has a legislative tracking system. And so you can sign up for that and you can put in keywords like mental health or substance use disorder or recovery, and any bill that has those keywords in it, you'll get updates on them, and you can follow different bills that you want to follow. If you need to kind of dive deeper in like how a bill becomes a law, the schoolhouse rock sort of stuff, we do have that stuff in Recovery Advocacy Classroom. It's in the Legislative Solutions class, just like this video will also be there. And then the last piece is just keep checking in with your sponsor of the bill and your sponsor staff. Really ask them what the next steps are going to be. And that really kind of, they can kind of help walk you through that process. If you have that one staff member in in the staff, and people that are on committees, legislators that are on committees generally have more staff, which can be helpful if one of them is your actual sponsor of the bill that you're working on. So that's my sort of portion here. I'm going to stop the screen share here. Give me 1 second. Come back to the Zoom. Hold on. Hold on 1 second. Can you all hear me? Am I still here? Hold on. I got, all right. Y'all can still hear me, right? Yeah, okay. So I got a new computer. I don't know where everything is. I see you all now. I'm going to pass things over. We're done with the slide sort of piece to this. The rest of this, we really kind of want to hear from the experiences of a couple guests that have some expertise in this department. And then we're going to kind of keep things open for Q&A. And so you can use the chat, and I will we'll change it so people can come off of mute to ask their questions at the end. But I wanted to pass things over to Representative Lauren Davis, who lately it's been great. I just got to call Lauren and just talk about public policy, and she was helpful in making suggestions to the model legislation site. And so I thank you for that. And so with that, we're going to pass things over to Representative Davis.
Great, thanks, Aaron. Good evening to most of you, and good afternoon if you're on the West Coast. It's nice to see everybody. Thanks so much for having me. So my name is Lauren, and I represent a district that includes kind of the northern part of the city of Seattle, and then a few cities north of that in the great state of Washington. I've been in the legislature just 3 years, so pretty new-ish. And I actually accidentally became a legislator because I was actually advocating to the legislature. And so just watch out, you may end up in elected office yourself, which would be wonderful. But I, was doing work really very much motivated by some, personal both sorrow and tragedy and hope and recovery in the lives of many loved ones significantly impacted by substance use disorder, and then started doing some advocacy to the legislature around both addiction recovery and some suicide prevention work. And candidly, I just had that experience that I'm sure many of you have had, where I hate to say it's intoxicating, but the process, the policy process, and getting something, actually watching something that you worked on, that you testified on, that you lobbied your own lawmakers on, actually come to fruition and become law. The reason I get so excited about RAP is because the pace of play at the state legislative level is really rapid. So, people ask me like, oh, what are your political career aspirations? And I'm like, you're looking at it like, this is it. This is the pinnacle of my political career. Why? Because state legislatures are these laboratories for policy innovation. I mean, you think about any movement. I frequently analogize our addiction recovery movement to the movement for marriage equality, and how it really was the state by state by state by state effort, and then ultimately kind of this national explosion of support. But you can do so much. I mean, you can pass things, mammoth policies in a single legislative session at the state legislature level. And then, imitation is the most sincere form of flattery. You can see that policy then spread across the country, where, no offense to DC, but they can take, 10 years, right, to work on one piece of legislation. And yes, when they pass something, it affects the 300 plus million people who live in this country. But when I pass something with my colleagues, it affects 7.6 million people who live in the state of Washington, which is incredibly significant. And it's frankly not that hard. I guess that was sort of one of my early observations about doing advocacy work to the legislature, is like, hot damn, it actually worked. Like, the first bill I ever worked on had to do with suicide prevention. And the first time I ever testified to the legislature was in 2013. And I, candidly, I was testifying to my own senator from my own district. And I had no idea he was my senator, didn't know I had a senator, and ended up getting elected 5 years after that. So you can learn a lot pretty quickly. But on that bill, I shared about my own experience as a high school student that was suicidal, and the bill had to do with suicide prevention training for school counselors and teachers and whatnot. But anyway, the damn thing passed, and I was like, holy shit, like that wasn't, I mean, that's wow, that actually happened. And that kind of lit this fire in me. And what we did on that bill, we didn't have a lobbyist. We just had I shouldn't say, but we had suicide attempt survivors, people like me who had experienced, significant depression and suicidal ideation. And we had lost survivors who had lost loved ones to suicide. And we went to the Capitol, and that same has been true for all of the addiction recovery work that I've done. My day job. So Washington is like most legislatures, I think there are 10 full-time legislatures. So most legislatures, including mine, are a part-time legislature, and they generally don't pay very well. So, I make, it's public information, $56,000 a year, and I represent a district that includes the city of Seattle, which is one of the most expensive places to live in this country. So unless you're independently wealthy or retired, which unfortunately tends to be a lot of legislators because the pay is so low, you have to have a second job. And my second job, I work with an organization called the Washington Recovery Alliance, that really, like many of the other RCOs, kind of born out of this gap that existed in our state around a lack of recovery voices at the Capitol. So I still work for that organization in a part-time capacity. I obviously don't do advocacy work anymore for the organization because that would be inappropriate. I do plenty of advocacy work in my legislative role, but we've kind of followed the same playbook, and that organization has been enormously successful legislatively, both prior to me, them kind of having a plant in the legislature in the form of me, and then certainly afterwards as well. But our key to our success has really been nothing more and nothing less than person power, than grassroots stories, than mothers who've buried children to this disease, than people who are thriving in recovery and parenting, who lost children to CPS at some point, who were incarcerated, who experienced homelessness. And those individuals are our tickets to every legislative office. So most lawmakers are the same. We prioritize meetings with constituents above any other meeting, any other lobbyist, any other group. We roll out the red carpet when we have our actual constituents from our actual district who want to meet with us, because that's our job, right? I represent 157,000 people, and they are my bosses. Whether they voted for me or voted against me, I represent them. That's my job. And my job is to listen. My job is to listen whether I agree or disagree. That is irrelevant. And my job is to act on their behalf and represent the district. And so I just think frequently people have no idea how much power they hold just because you have an address in a state, in some district, that is your golden ticket to entry into the offices of the senators and representatives, unless you're in Nebraska, which is unicameral, but the people who represent you. And there is incredible interest, I'll say, in this topic, in large part, tragically, because of its reach. So to give you a flavor, in the Washington State House, there are 98 representatives, 57 Democrats, 41 Republicans. And of my 41 Republican colleagues in the House, currently serving 4 of them, so about a tenth of that caucus, have adult children with substance use disorder, some in active addiction and some in recovery and some in and out of. And who do they call at 2 a.m, when they find their child on their laundry room floor? They call me, regardless of party affiliation. And who do they vote with, regardless of party affiliation on this issue? They vote with me because they understand. But I guess what I would say is, despite people's great interest in this topic, it doesn't mean they have the knowledge, right? So you really have an incredible role in helping steer and helping people understand, okay, fine, we understand, opioids, methamphetamine, we have challenges in community, but what do we do about it? And that's where you guys come in. Just because they have the will doesn't mean they understand the pathway. there's an incredible amount of education that I've done to my own colleagues just in the 3 years I've been in the legislature about this thing called recovery, because the state of Washington, like most states, funded prior to my arrival primarily treatment and treatment only, right? So didn't fund any outreach, any effort to connect people to services because you can't bill insurance for it. And then we didn't fund any recovery services because you can't bill insurance for it. But helping lawmakers understand that recovery is more than treatment, and that actually you have to fund all three legs of a three-legged stool instead of only one, or your system will flop. And it's sort of like this light bulb moment, whether I tell them that as their colleague, or an advocate tells them that, or a mother tells them that, or a person in recovery tells them that. It's incredibly significant. I could go on and on about telling you stories, and but I guess and I look forward to the questions, but if you hear anything from me, it's just that, like, please exercise the power that you have, and please bring others along with you, even people who have incredible trepidation around talking to an elected official or a lawmaker. At the end of the day, like, we are all the same, and your lawmakers have great interest in what the struggles are of people in their community, and they will listen and they will act, but they are only capable of doing that if you provide them the stories and light the fire and provide them the direction about where to channel that passion. So thanks again. Look forward to questions.
Thank you so much. I wanted to ask her you to talk for just a minute on one thing, because I thought I had a part of my slides, but I don't know, I skipped over it because that happens. The budget process in states, like, that is a part of the legislative process. Sometimes it's the only part of the legislative process that legislators are working on, depending on the time of the year. And the reason why I say that is because, like, our New Jersey team today, there's New Jersey, the budget and appropriations, like, they have public hearings, so constituents can go and talk about the issues they care about. And so in there, they picked one advocate to talk about the importance of funding LGBTQI recovery housing. Somebody else talking about the importance of funding more mobile units in the state, like harm reduction mobile units, and one person talking about funding recovery community centers in the counties that don't have recovery community centers. And so can you talk about, like, just briefly, like, the importance of, like, that piece as well? Because all the advocates here, just so you know, like, if your state has some sort of process of public comment periods of the state budget, and so it's important for us to kind of look at what that is. But I just wanted to ask you if you could talk about that for a minute, just because it came up today on one of our state organizing team calls.
Sure. And I don't want to pretend that I know a damn thing about how any other legislature operates other than my own. But I can tell you, for the state of Washington, actually the easiest way to get something in the budget is to kind of do it quietly, frankly. So we would have lawmakers sponsor what's called a budget proviso. And I guess I shouldn't say do it quietly, but the work, the bulk, I guess what I mean by that, the bulk of the work does not happen in the House Appropriations hearing, which is the hearing on the budget. You're way too late. It happens, like, in our state, and this is probably true in most states, the governor releases the first budget, and then the legislature uses that as a starting place. So your work starts way in advance. What you do is you lobby the governor's office, and whatever staff is assigned to behavioral health, you get it in the gov's budget. And then you do all the legwork in advance. You get someone, in our state, to sponsor a budget proviso, and you get it in the underlying budget for both chambers, the House and the Senate, because when we reconcile, the House and Senate do horse trading, right, about where they're different in the budget, but you get it in the budget that both chambers drop, so that there's no dispute. So by the time it actually gets to the budget hearing, like, that's just performative. It's already in the budget. That's your goal. That's not always the case. The time you want to be really loud is something gets left out, right? So they didn't fund your thing. Then you need 100 advocates to come. But in general, I would say, like, you've got, a 6-month backup from when you actually have that hearing, and that's actually when you should do your work. And you're too late if it's kind of starting or focused on the hearing itself. Hopefully that makes sense.
Yeah, it does. And I know the New Jersey advocates also testified at the department hearing of Department of Health hearing too. And so like that, there are different parts of the process through, and the budget process is a whole year round process. So, but so just to echo some of that, like learn what that looks like in your state, and the timeline for that. Thank you, Representative Davis. I appreciate you. And we're going to have you stick around just for Q&A at the end. I just want to pass things over to Shelly Weizman, who is from the O'Neill Institute of Georgetown Law. And there are some ways to dive deeper. I've pulled a couple Georgetown Law stuff off of and put it on the model legislation page, and kept seeing Shelly's name come up as I was building that part of the site. And so wanted to have her take some time to join us today and talk about the O'Neill Institute. Shelly.
Awesome. Thank you so much, Aaron. And how amazing to be here. Like, I feel like I talk with people a lot about how we need an army. And like, I feel like I'm looking at it. So awesome. So like Aaron said, I work at the O'Neill Institute for National and Global Health Law, which is like a health policy think tank at Georgetown Law School. And I also teach at Georgetown. I teach a class on addiction and mental health law and policy. And I've been there about 3 years, and I work with Regina LaBelle, who was most recently the acting director of the Office of National Drug Control Policy. So she's got obviously like an incredible federal perspective. And she also used to work, she was the legal counsel for the city of Seattle. So she's got the local government piece. And before I came to Georgetown, I worked in the governor's office in New York on New York's kind of addiction and mental health policy and operations. So Lauren just talked about, you know, coming to the governor's office when you want to kind of start the process of getting something potentially moving in the budget or otherwise. And I was the person in New York that people would come and meet with when they wanted to meet with the governor's office about anything related to addiction or mental health. And I'm a person in long-term recovery. And it was just an amazing kind of role to be able to be, you know, approaching policy from a place of lived experience, and also, you know, having the ability to get things done from the inside. And I, you know, much like, you know, probably many of you, I started out in, you know, in a program and then working for programs, and then thinking, there's a lot of stuff that's wrong and messed up in the system, and like we should change some shit. And so that's when I went to law school, and I worked for a while as an advocate suing the state of New York, and then went to work for the state. And I found that I learned an incredible amount working in government that I you know, would have taken me probably a really long time to learn from the outside, and got an incredible amount of stuff done in changing the insurance law, in changing what emergency departments have to do when people present with an overdose, in you know, say shaping where funding went that came down from the federal government, and a lot of other stuff that I'm really, really proud of. And I went to work at Georgetown. And one of the things I started in New York, but continued when I started working kind of on national stuff, was I met a lot of other people who had been working in government or in advocacy or in some other role related to addiction policy that were in recovery. People in government, high level positions in government, state legislature, SAMHSA, the CDC, like on and on and on. And I thought, wow, like there are a lot of us out there. And we, you know, started a network of people with lived experience who work in these types of roles, both in and out of government. And this group of people, we call ourselves the Recovery Policy Collaborative, we're like, man, we want to bring more people along. Like we have to build a bench here, and like find all of us that are out there doing this stuff. So one of the things that we decided was we wanted to start a fellowship program for people who have lived experience and are out there in their communities doing great work, but want to do a deep dive into a policy project. And so it's a little bit different than what you guys are doing here, but it might be kind of complementary. Essentially, it's like picking an idea, a big idea, or maybe you know, not a huge idea, maybe just something that would be really impactful, and getting a mentor and spending a year working with this policy collaborative network and folks at Georgetown, here at the O'Neill Institute, and at the law school and other schools at Georgetown, to really like get a plan in place and get it done. And a lot of the time, it probably wouldn't necessarily involve drafting a bill and going to the legislature. Sometimes it would involve a whole kind of group of steps in place that may or may not include legislation. It may or may not include even funding, right? And so applications are open for this fellowship. Now, I think that Aaron has the link to put into the chat. And we just did an information session about it. So you can take a look at me talking about this for like in more detail. And I don't know like where this information session started, but at the beginning I was like deer in headlights about how many people signed up and wanted to learn about it and be part of it. And it really shows me that we've got a lot of work to do with capacity building, and like seeing here, like what you guys are doing. I think we can probably take on like maybe 5 people. And so this is like amazing. And so it's for folks that are leaders or emerging leaders in your community already. And you really want to dive in deep on a project. The other thing I'll talk about quickly is we also have a new master's program in addiction policy and practice. And actually, one of the master's program students is here in this group, and it's really, really awesome. And this is a 1-year master's at the Georgetown Graduate School of Arts and Sciences. Regina LaBelle is the program director, and there are courses on essentially like all the things that we think, all right, this is what, you know, we needed to know, and wish we would have known at the beginning of this journey, like a class on finance, healthcare finance. That's everything. Like you cannot separate the law and policy from the money. And I'm going to just like totally put a plug in for what was said about the budget. Like, know and understand your state's budget process. It's not just an afterthought. It's everything. It's everything. Because if something you want to happen costs money, and mostly it does, it probably will not happen if it's not done in the budget. I mean, it might, but much less likely. And this was stuff that like I didn't know as an advocate before. I didn't know that there was a cycle, that there was time, that there were certain times that you needed to go to certain people. There's a lot to learn, and it's not very intuitive at all. And so like in this master's program, there's a class on healthcare finance. There's a class on like the history of US addiction policy. There's neuroscience course. There's an epidemiology course, like really understanding the science of addiction. So you can do, again, like what was just said, educate and understand, you know, ourselves, understand like what is going on in our brains. And then there's also a seminar that kind of ties it all together. So it's 1 year, which most master's programs I think are 2 years. This one we were like, we're going to pack it in because can't wait. We need more people who are empowered and armed with the knowledge and network to get this stuff done. And we've got other opportunities at O'Neill, at internships, externships, if you're a current graduate student or law student. I don't know if anybody is, but folks can always feel free to reach out for a conversation. You there's more and more of us out there, and knowledge is power. So yeah,
Awesome.
links I
Thank
think
you.
are in the chat. Thank you guys.
Thank you so much. Yeah, I dropped the link to that in the chat. If you are personally wanting to deep dive into the policy world and take that on, and I just love the fact that something like that even exists where people can apply to have mentors, and that's amazing, Shelly. Thank you.